Hello, good afternoon all. Good morning. Good morning, this time. Yeah, sorry. My name is Dia Ibrahim Abudris, and today I'll present the infection control, prevention and control update for 2024. So, the objectives of it's actually the outline. So we will go through the standard precautions since it is the basic steps for preventing the infection. And we will go through the important points that highlight the infection control and prevention. Like, for example, we talk about single-use device and also concentrate on transmission-based precaution. Okay. So infection control, it's to prevent first. So most of our concentration and steps will be in preventing the infection. Then if the infection happens, we will try to control it. Okay. So the basic definition for standard precaution is to minimize the transmission of infection. Is to minimize the transmission of infection and to control it. And when applied consistently, standard precaution can prevent the transmission of microorganisms between patient, healthcare workers, and the environment. So it is basic infection control practice to prevent the transmission of infection within healthcare facilities. So if we go deep on standard precaution, it consists of 9 components that we will take it in another mandatory lecture. For example, hand hygiene is the first and the most important steps, not only in healthcare facility, everywhere, to protect ourselves and the surrounding environments, and means to prevent. The first step to prevent infection is to perform effective hand hygiene. Okay, so it's also to know the concept of infection prevention is to know the 6 components of chain of infection. So the 6 component is infectious agent, as you can see here, infectious agent, reservoir, portal of exit for the pathogen, means of transmission, portal of entry, and susceptible host. So to implement the standard precaution, we need to break at least 3 of this infection chain. For example, if we have a susceptible host, like patient with comorbidity disease, diabetics or hypertension, or patient on chemotherapy, how we will prevent infection is to place the patient in isolation and to prevent the exposure of this patient to outside pathogen. Okay, and for infectious agent, how we can break the chain, laboratory, how we can break the chain. Yeah, it's hand hygiene is implemented to break any infectious agent, but from laboratory we are waiting for the lab report to identify what type of pathogen. So if we know whether it is virus or parasites or bacteria, we will know how to break this chain. Okay. So also standard precaution, it's important to include the cough etiquette, cough and sneezing etiquette. It's not only to prevent transmission between healthcare worker and to the patient, but also within the facility between ourselves. So we have to know the steps for cough etiquette and to recall the steps and teach our patients also. So cough etiquette is either to sneeze or cough in a tissue or an elbow. If we use our hand, we have to perform hand hygiene. But most of means frequently we see that staffs or visitors, they cough in the air. So the transmission, if patient has an airborne pathogen, the transmission of pathogen will be, risk for transmission will increase. So hand hygiene, as we mentioned, should be performed in the 5 moments. We have to recall it and to implement it. So before touching patient, before a procedure, and after a procedure or body fluid exposure, after touching a patient, and also when we reach the surrounding of the patient, we have also to perform hand hygiene, even if we did not do any procedure. So that this surroundings, if we touch the bed or the area which is highly touched by patient or visitors, we have to perform hand hygiene. The PPE, all you especially during COVID, we all know the types of PPE that we have to utilize, like for gloves, gown, mask, goggle, visor, or the visor with mask, or another word is the face shield. And it's important for you to know where it is located, and you should have a stock in every department of all the required PPE. Okay. And also it is important to know the sequence of donning and doffing for putting on the PPE and for removing PPE. Why? It's again to reduce the risk for transmission and for contamination of the PPE before going to the patient. So for putting on, we have to perform hand hygiene. First is gown, okay? Not the gloves, because gloves, we have to wear it at the last before we perform a procedure or before we go to the patient. So we should not touch the door or touch anything before, or even touch our face before going and doing the procedure. So first is gown, mask, goggle shield, gloves. Last is the gloves. And for removing is the opposite. First is the gloves, perform hand hygiene to protect yourself. Then you have to remove the face shield, then gown, then the mask. And for respirator or N95 mask, especially if you are caring for a patient with airborne disease, where you have to wear the respirator. Where you should remove the respirator outside the empty room. So after you come out from the air, the negative pressure room, you have to remove and discard in biohazard waste. Any question? Okay. How to properly put on and take off disposable respirator. Okay. So again, we have to perform hand hygiene. And from the picture, it's clear how to put in the loop and how to check if the seal is intact or not. Why? Because you need to make sure that you are not breathing from the edge, especially if you are caring for TB patient or measles, or even if it is suspected cases. So you have to protect yourself and protect your co-workers by proper putting on and checking the seals of the respirator. Okay, so you should breathe from the filter of the mask, not from the seal. If the seal is not, it is not fitting you, you have to change the size or to adjust it properly. Okay, any question? Okay, so for removing, make sure you are not touching, because here the most area for microorganism, for pathogen to accumulate from outside the mask. So you have to remove the lower loop and carefully dispose it in biohazard waste. Okay? And of course, you have to perform hand hygiene. So when standard precautions are not quite enough, so we have to use contact droplet and airborne precaution. So we will go in brief about each one. Contact precaution is used for patient which the transmission of pathogen will be through contact. So we have to place the patient in single room. Gloves should be worn, gown, and of course hand hygiene is required. Okay, so how we notify the co-workers or the visitors that there is an infection and the contact infection or droplet or airborne, how they will be notified? If you have if we have patient with MRSA, you received a lab report with positive MRSA, how you will place patient in isolation room, or each single room in all wards is it has a single air conditioning circulation, so we can place patient also not necessary in airborne isolation, which is available in each ward. There is one airborne isolation room with negative pressure, but for contact precaution, it's also the patient can be placed in single room. So we will place patient in single room, or we will keep this signage, but without all these details. So all of the healthcare worker at AMH should know the color coding for isolation precaution or transmission-based precaution. So for contact, it is orange. So we will place orange sign, and it is stated that please refer to the nurse or the healthcare worker for more instruction. Because it is really, I worked before also in private hospital, it is challenging for in private hospital with a demanding patient that no one wants to know that they have any type of, it's a type of sort of privacy. But we have to notify all the doctors, nurses, visitors that to take precaution before entering to the patient. So for contact precaution, it is orange. For droplet precaution and used for which type, for example, influenza, seasonal influenza. It's also preferred to keep patient in negative pressure, but since it's limited, so because air conditioning is individual in each room, so it is enough to place patient in a single room. And the color code is yellow. Okay, so the most important PPE to wear is the mask. So if you want enter to the room without doing any procedure, just to say hello to the patient, so it's enough to wear the mask, because the mode of transmission is by respiratory system. Okay, and for airborne precaution, we should make sure that the respirator or N95 mask is available. We have stock, because we can expect any time to have to receive a patient with TB or measles, chickenpox, pulmonary TB. So most important is to wear the respirator, the properly putting on and removing. Okay, and the color code is blue, without any instruction, but the staff, or the visitor will be instructed to take more instruction from the nurse. So orange, yellow, and airborne is blue. Okay. So in Manama, MSPU and dirty utility room, it has negative pressure room. And in KHAMH, ER dialysis center, one room, means in dialysis center. And all inpatient, one single negative pressure room. Triage, all triage, it has negative pressure. Infertility center, CSSD, in the dirty receiving, where they receive the used instrument, they have negative pressure, bronchoscopy. So we have to maintain or to check if the negative pressure is functioning in that room. So in KHAMH, okay, if the door is open, the ball will be in red. You can notify red color, so it means you have to close it. Door has to be always closed to maintain the negative pressure. Okay. And in KHM and MSPU, means there is a monitoring pressure in the room, and we have to record that in each room there should be the checklist, and we have to maintain recording and notify the maintenance department if you notify any default. So what is the concept of negative pressure? Or manually, how you will check the negative pressure? You can, if you open the door and you place a tissue in the floor, the tissue will be drawn inside. But if it is not positive pressure or the negative pressure is not functioning, the tissue will fall down. It will not be drawn inside. So the concept for negative pressure is to take the air from outside from outside the room to outside the HEPA filter. It will be filtered and to a system where maintenance they maintain the system for the air not to be circulated in the hospital. So negative is not to prevent the microorganism from coming from patient room to outside room. That's why we have to keep the door closed and the system should be functioning properly. Where the positive pressure, mainly in certain rooms in OT, positive is the opposite. Is the air will come from the condition to the outside. We don't want any air to come from outside the room, especially in OT for very strict, sterile environment. Okay? Any questions so far? So the nurse or responsible person has to fill the checklist and the form and notify the maintenance department if you have doubt in maintaining the pressure. Okay, for reporting communicable disease, in coming week, it will be different, but the type of disease that need to be reported is the same. For example, group A diseases need to be reported within 24 hours. And for the diseases that notified by the telephone icon, it has to be reported immediately. Group B and C within 1 week. Okay. So, and means for doctors, any type of communicable disease should be notified to the nurse, and nurse will report to infection control department. And according to the type of disease, we will make sure that it is reported on time. And weekly, every Sunday, we are reporting the whole AMH 5 center. We are reporting to public health. But okay, before that, for certain disease, in this old reporting system by Excel and email, we will report. We need to fill a special form. For example, for rotavirus, there is a special form that has to be filled by a doctor. And for mumps and measles, also, if required, we need to collect blood sample. And case report is required for some rare disease. There is hotline for notifying. If you have any inquiries, they are also ready to answer for public health and for vaccination. So as I mentioned, this reporting is by email every Sunday. But in coming few weeks, we will have a system that is now it's under trial. So day by day, we are reporting immediately any type of communicable disease. And at the end of, this is for all 5 centers. And at the end of the week on Sunday, we have to make sure that all reporting, all the reported communicable disease is entered in the system. And on Sunday, we will make sure as infection control, me and Sister Jency, to submit So our responsibility as infection control is to follow up with all 5 centers. Then we will submit on Sunday all the reported communicable disease. So this is most probably will be on 1st of February. It will be implemented in all Bahrain. Okay. So for injection safety, it's important to maintain aseptic technique. And one important steps is if the vial is defined as single-use vials, should be used once only because there is no preservative. And if it is multi-dose vial, we have to use it for one patient only, even if it is multi-dose. And for the defined period of time, then we have to discard it. But if the medication is difficult to supply with enough quantity, we can use it for multiple patients, but we have to use strict aseptic technique and to prepare that what is implemented here. We have to prepare the medication in designated area, medication preparation room that is designed only for preparing medication. So multi-dose vial, it has preservative, but you have to keep in mind to use aseptic technique because it will not protect. I mean, doesn't have effect over bloodborne disease for hepatitis or HIV. So don't think that the preservative will kill the organism, but it will minimize the growth of certain contaminated microorganism. Okay. Single-use device should be discarded after use. We should not send for sterilization, and NHRA are very strict. They need to see a documented policy, and they will check for implementation also. I will not go in deep of antimicrobial stewardship, but this method for calculating the dose, the defined daily dose, maybe by graph it will be clear. So it is a way for antimicrobial stewardship. It's a way of controlling the use of antibiotic. So our aim is not stop using antibiotic. It's required to save the patient life, but we have to know when we have to use the dose and the period for using the antibiotic. So one way of monitoring the use of antibiotic is by antibiotic prescribed in a gram and antibiotic prescribed in daily defined dose. So it is assumed average maintenance dose per day. So if for daily defined dose, 21 means for every 1,000 patients seen, there is 21 patients were prescribed for antibiotic. And again, we will not go by number. There will be analysis of the prescription. Means why it is used for, is the type of antibiotic is appropriate for this type of pathogen or disease, I mean for the infection. Okay, and this is advice can be shared with your family, with the community, that we have to again remind that antibiotic is used for bacteria, not for virus. Most even educated people, they once they have flu-like symptoms, and so that they feel better to use antibiotic. Okay. This is also very important slide, is for safe using of, protect yourself. Means a standard precaution where you will judge how you means when you will use the face shield. For example, if the surgeon in the theater, they have to cover their, or the staff also, they have to cover with the face shield. So in case why? To prevent body fluid exposure. So if this exposure happen, there is a risk of transmission of, we don't know what patient carry any type of pathogen. So what you will do if your eyes exposed to body fluid, either vomit or blood or any type of body fluid. So each area, there should be a designated, there should be a supply of, it is saline, mainly sterile saline, that you have to irrigate your eyes or the area that's affected. Okay? So a standard precaution is required to prevent any blood and body fluid exposure. Okay. In case of sharp injury, first of all, we have to have the sharp container in any area where we are expected to dispose sharp. So it should be available. And we should not recap most of the incidents that we receive, because the staff or the doctors, they recap the needle. So we have to dispose the used syringe as a whole directly. Before, we advise the staff to use one hand method, like to keep your hand at the back and use a scope method. But again, with this method, still there is a chance for having incidents for needle break. So directly when you used the syringe, dispose it as a whole. And you have to post-exposure to encourage wound to bleed, but do not squeeze. Wash affected area. Rinse mucous membrane with the warm water. And you have to report to your supervisor and report it as incidents report. Plus, directly you have to go to the emergency department. Okay. And for immunization, there is strict control from public health, from immunization center. We have to maintain the temperature according to the required what type of vaccine is available. If it is not freezing, this type of fridge is available here, and we have to use special type of thermometer that will record for the whole month. And this type of thermometer will record also if there is these less than it is 2 to 8. 4 to 8 degree. If it is 2, it will record. And when they come for abrupt visit from immunization center, they will, first things, they will check the thermometer, whether there is any cross report. And we have to maintain according to the policy and according to the circular from public health. And for infection control, IDC audit, we audit the patient area. This is mainly done by infection control link nurse, but we oversee them. They will check the patient care area, isolation room, storage room. There will be a checklist to maintain and to make sure that the area is cleaned and the risk of infection is reduced in those areas. But in a specialized unit like dialysis, there is a bundle and surveillance that we are closely monitoring. The staff is maintaining and we are closely monitoring. And also in ICU, in the kitchen, water sampling are done every 3 months in the required area. Okay, so that's all. Okay, still there is time, no? Or this is very important for transporting instruments, used instruments, it's contaminated. So we have to have closed container and there should be a sign for biohazard sign. It should be transported to CSSD directly. We should not wash the instrument inside any area in the hospital. So there is a special spray that will prevent the sticky of blood and body fluid over the instrument. So we have to spray and directly transport to CSSD department. So we should not wash. So it is. So this you should have 2 boxes, one for used instrument, the other for sterile instrument for receiving. Okay. So the specimen must be packed in a leak-proof container. So in case of a spillage occur inside the carrier, use appropriate PPE with specimen, place the specimen and requisition of contaminated in a plastic bag. So here also we have to take care. Infected specimen should not be transported in pneumatic tube system. It should be transported in closed the container, and we have to transport it manually to laboratory. And we have to take care to properly seal this container and to place the plastic bag. Okay, so because in case of spillage inside, there is special procedure from the company. They need to come and to clean, and it is because once spillage inside, it need to clean the whole tube. So we have to prevent and to take care, properly seal the container. Also here for each waste and linen transported through AGV. And there is one AGV only for the dietary. Okay. So there also they have checklist for cleaning. And for color-coded laundry bag, this is implemented in Manama, but in coming days it will be implemented here also. So red is for biohazard and green bag sold for theater. And this is for used dry linen. Okay. Medical waste, this mainly you will see in theater and labor room because this used for body part, placenta, and here yellow bag is for biohazard or infected waste. Black is for general waste, and this is for sharp container. Okay. For heavily soiled linen, that there will be risk for transporting with the other linen, so we have to there is a procedure for discarding, and we have to notify the waste manager well. We have to notify of before discarding. A medical waste room, all of you know where it is located, in the basement, and we have to the size and the temperature is maintained properly there, and it is used to collect all medical waste only. Biohazard waste will be collected in the special room in the basement, and the company will come every day to collect for incineration in Bahrain Medical Waste Company. So this is, and we have to know the type of disinfectant, mainly of the healthcare worker. They will use the low-level disinfection to clean the instruments, and CSSD, high-level disinfection. So each area should know what all the disinfectant is available and the way how to use and disinfect. Last but not least, and the most important slide is the NHRA elements, which should be implemented in all area in KHAMH. So that an accreditation will be on March. So all has to have infection control manual, especially in special areas. So most of area are aware of the checklist that they have to use, and they at least once you have to go through all element. Element 10 is about the infection prevention and control. So mainly it is handled by me and Sister Jancy, but each and everyone in the hospital should know what should be implemented to prevent the infection. Okay. So, thank you. Any question? Yes, Rexan. Yes. Using gloves. Yeah. So for if you are using an infected in microbiology lab, for blood collection, if it is you have to refer to the policy. If it is soiled with blood more than 20 ml, you have to discard it in biohazard. The yellow coded waste bag. But if it is not contaminated with the blood, it can be discarded in the black. Yeah, you mean for any gloves that you... General. Yes. If it is heavily soiled with blood or body fluid, so you can refer to the infection control policy that is also referred from GCC. It's sometimes it is difficult to accept it, but because the risk of infection from the environment, the waste is less, so we have to concentrate our resources and effort to prevent the infection by doing hand hygiene and frequently disinfect the area where you are doing the procedure. So if you remove the gloves and discard it in the general waste, No one will go and touch the waste. It will go, means medical waste will go in for incineration. There is special procedure for disposing and processing, discarding the biohazard waste. But for general waste, it will go with the municipality department. And why they changed the policy? This is more than 20 years. It's implemented because they found that the risk of infection from the waste is less than other areas. So we have to focus in cleaning the area where we, like for in phlebotomy area, between each patient you have, of course, to do hand hygiene and to minimize the items that is kept over the area. Why? Because you have to disinfect for the new patient. So this is the where we have to concentrate to minimize the risk. To remove the gloves, discard it in general if it is not heavily soiled with the blood or body fluid in general waste, and to do proper hand hygiene and surface disinfection. So you can refer to, or we can discuss it more with more reference from CDC and WHO, with that is researched and evidence based. That's why they changed the policy. Okay. Any more question? Sorry. No, no, the presentation will be recorded and available in the iPad.
Any other doubt? Questions? Anybody from the online?
Any question from the participant from online? Okay, chat. Okay.
Okay. Thank you, everybody.
Thank you.